struggling with muscle tension in the neck with limited range of motion in multiple directions that maybe cause a headache, you may be dealing with the cervicogenic headache. I'm Dr. Peters with Omni Chiropractic, sports chiropractor, providing solutions to pain and performance. So the interesting thing about a cervicogenic headache as opposed to other type of headaches is that it's the neck is the cause. A lot of different types of headaches, whether it's migraines, tension type headaches, have neck pain associated with it, but it's not necessarily the cause. So with the cervicogenic headache, it's most commonly the muscles or the joints of the neck that refer pain into the head. So referred pain just means pain that travels. The problem area is not where the pain is perceived. So obviously with a headache, we have perceived pain in the head, but with the cervicogenic, the problem is in the neck. So most commonly, we see limited range of motion with our different neck tests. And we also see substitution of these big muscles on the side because of deep neck flexor weakness. So two most common causes is muscle tension in the neck and limited range of motion. So if that's you, it might be a cervicogenic headache. The facet joints of your neck or this part of your spine can actually refer pain into your head. So most of the time it's the upper cervical joints that refer into the head, so we can manipulate those in office. So stay tuned. Culprits and headaches that chiropractors can help with is limited neck mobility. So a lot of times our upper cervical spine in particular, those first 2 or 3 or 4 bones of our neck get restricted, and those cause and can refer into the head to cause headaches. So whether it's migraines, tension type headaches, cervicogenic headaches, we have to assess that area, and how we do that is through 3 tests as well as just putting our hands and actually feeling how those joints move. So the 3 tests is we have the flexion test. Can you get your chin to your chest? We have the neck folder test that I like to use. It tests more extension. Can you look up and balance a folder on your... And then the last one kind of checks rotation. The majority of your neck rotation or ability to turn your head comes from the upper cervical spine, over 50%. So when you flex and then rotate both sides, we're looking for 40 degrees of rotation each way. If you're limited, a chiropractic adjustment can kind of help restore that mobility, and then we send you home with a cervical spine snag. So if I wanted to improve my right rotation, I turn this way and I can apply a little bit of overpressure, and I can actually send the patient home with an exercise to maintain the range of motion in their upper cervical spine after a chiropractic manipulation. That's the in-office treatment and the at-home self-care solutions that we like to use here at Omni Chiropractic. So upper cervical spine, super important. We have to be able to assess that joint range of motion. We have to be able to clear that restriction, whether it's through an adjustment or some self-mobilization, and then people find that the intensity of their headaches improve, the frequency of their headaches improve. Those are all super powerful things that patients have increased productivity at work. They just feel better. So I wanted to kind of dive in. The upper cervical spine is so important for all the different headache types that we treat here at the office. But most importantly is that we not only are able to help them, but we're kind of give the patients something to work on to help themselves. Supine neck flexion test. All you're going to do is you're just going to lay on your back and you're going to bend your head up and you're going to look at your toes. And then we'll talk about 2 of the findings that we see and what that may or may not mean. So you lay flat on your back. Hands on your stomach, just kind of look up at your toes and go back down. First off, is there any pain with that maneuver? This should obviously be pain-free. And then we look, what does the chin do when you look at your toes? Does the chin stay retracted as you look up and you can bend through all the way down your spine? Or does it thrust your jaw forward? A lot of times we see patients, especially our desk workers or people that have these long-standing headaches, whether it's tension type headaches, cervicogenic headaches, is that jaw thrust kind of clues us into is we have weakness or inhibition of the deep neck flexors, the ability to retract and maintain that as you look up. But we also see joint dysfunction in the upper cervical spine. So that means hyperactivity in these suboccipitals, weakness here. So through a combination of chiropractic adjustments, maybe dry needling, at-home exercises, we're able to clean up that neck flexion pattern to not only restore the range of motion, but improve the quality of the movement. So we're utilizing the right muscles, so more deep neck flexor activity, less activity here in the back where a lot of people kind of have that chronic myofascial pain. So supine neck flexion test, just lay flat on your back and look up and kind of see how it feels, and then see how you move. Maybe you can